Childhood behavioral disorders can range in severity. Many parents feel helpless when they can no longer control their child's behavior. Dr. Brett Patterson of Children's Hospital of Orange County discusses how peace through compliance can be an effective discipline strategy.
The negative behaviors that I end up dealing with kind of cover the range. It could be oppositional defiant disorder, it could be attention deficit hyperactivity disorder, but we also work with a lot of families that just are struggling with challenging behaviors. When parents come in, they're generally looking for peace through compliance in the home. When we ask them directly, quite often what they ask for is more effective discipline strategies. We encourage the positive behaviors through what we call reinforcement techniques, anything that we do to encourage the likelihood of seeing a behavior again. We really want to be proactive prevention based, and so if we can really focus on that piece first, catching behaviors that we want to see, commenting on that, recognizing that, then what we do is we encourage more of those, and then when we do see some of the challenging behaviors, as a second line, then we build costs in for the bad choices or the challenging behaviors. Without a question, the place where I see most parents struggle is in the area of consistency. When we see two parents that are not on the same page, that also affects consistency. When we talk about consistency, we're talking about consistency overall in the home, whether it's a parent saying what they mean and meaning what they say and following through with it, or whether it's one parent saying one thing and another parent saying another thing, and a child being kind of caught in the middle of that.
Dr. Patterson discusses encouraging positive behavior.
The behaviors are adaptive mechanisms that we use to get our needs met, positive and negative behaviors. And a key word for me in that is adaptive. If one behavior that I'm doing isn't working to get this need met, then I'm going to change and adjust and adapt my behavior. And we use positive and negative behaviors to do that. What we find with kids is that if the positive behavior isn't working to get that need met, then they will progress, maybe change it into a little bit worse or a little bit worse until some point where it forces some reaction response, and then at that point, then the need gets met. So for example, if you take something like lying about their homework, parents can get really frustrated about that, say, oh, this is a terrible behavior, they're making bad choices, they're lying to me. I would take the perspective that the lying is working for the child, because if it's getting a lot of attention, creating a lot of conflict or fight, at least it's pulling them into their world. Maybe it's helping them escape homework, and that's something that they're trying to do, is get out of having to do it. Looking at, well, what's the purpose being served by the behavior, whether it's lying, whether it's tantrums, whether it's whining, negotiating. If you really want to impact behavior, there's two things you have to have. One is credibility and the other is leverage. So credibility we gain through consistency. That credibility buys us a lot of leverage in this. Now, I say leverage because the other part of this that you need to have is leverage. If the outcomes have value, if my good choices have valued outcomes consistently, and my bad choices have valued costs consistently, then that's really those two pieces that we have to make that. When we start talking about discipline, we frequently will have parents bring up the idea of corporal punishment, saying a lot of things about this is how they were raised and it's how they learned to parent, and have questions about whether they can or should use that. And I think it's really important for us to have that conversation about how times have changed, how approaches have changed, and also a lot of the risks that go with it. We know that when we're looking at behavioral disorders in particular, that behavioral treatments through a board-certified behavior analyst, a behavioral psychologist, mental health treatment can be hugely successful. If you look at ADHD, for example, if we combine the medical treatments, medications, with the behavioral treatments, that's really where we're looking empirically in terms of the key treatments. Now, not every child who's coming through with ADHD is going to require medications. We start with the behavioral treatments. We really try to implement those, really try to provide that support, and then for some kids who are having a hard time responding to that, then we know through the literature that the medications can help support that child to make the behavioral treatments work better. And so I really reinforce and encourage parents both to take time for themselves and also take time with each other to nurture both their personal health and the health of the relationship. Just to nurture the relationship, model a positive relationship, model self-care, and then be able to bring a little bit more of that health into the home.
Parenting is hard enough, and dealing with behavioral disorders can be stressful, but don't lose hope, because there is help for you and your child. For the American Health Journal, I'm Laura Windsor.